I think as adults, it's important for us to own our health, for us to create a team approach with our physician, with our providers. There are 5 steps that the National Institutes of Health recommend that we as adults need to use when we think about, I am going to schedule my wellness check. And the first one is schedule that wellness check.
According to the National Institutes of Health, even if you feel fine, you should still see your health provider for regular checkups. These annual visits can help you avoid problems in the future. For example, the only way to find out if you have high blood pressure is to have it checked regularly. And simple blood tests can check for high blood sugar and high cholesterol, which may not have any symptoms in the early stages. On today's Sound Living, the importance of health screenings. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. The Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, Elaine Johannes, says we need to make getting an annual wellness exam a priority. Elaine, one of the things we don't often recognize is the fact that there's really a difference between a wellness exam and an annual physical or an annual exam.
Yes, Jeff, that is true. So a physical, if we remember having a physical, usually it's to maybe identify a concern, identify a disease, a diagnosis. We think something's not right. We go in as an adult, we go in and we get a physical done and something is checked and boy, thank you. A wellness check, though, is to make sure that we are as healthy as we can be. There are some indicators, screenings, we'll call them that, screenings of primary parts of who we are from head to toe. And those screenings are done hopefully annually. And those screenings are to just make sure that we're working well and could be caught early enough to really treat it without having to do a lot of, invasive other kinds of things. When we think about wellness checks, I think as adults we need to own those. We need to be active in our health.
And these are going to be a little bit more in-depth. They're going to take tests. They're going to run all sorts of diagnostics. So this is a little bit more involved. And you should get more feedback just based on the tests that they're doing.
Yes. So let's just take adults as we age. The National Academies of Science and the National Institutes of Health have lists of screenings that we should have in our wellness checks. And as we get older, those lists get longer, as does our potential to have maybe some illness. So if you are between the ages of 18 and 39, no matter if you identify as male or female, those lists are like maybe 10 items, head to toe, dental, eye. For women, it's a reproductive health check. Men, yes, testicular cancer is a concern, so get that checked. But as we get older, the screening list gets longer. So the National Institutes of Health have a list of 15 things that really are part of our overall health when we get over the age of 65. And those do include diabetes checks, colonoscopy, the blood pressure, hypertension, cholesterol, all of the lab tests. And then we get just our regular physical, osteoporosis, how's our bones doing for women and men both. And then also that hearing and that vision. And then also we start seeing more screenings in our mental health. Adolescents do have their own screening, and doctors, either the general practice physician or the family physician, has a list of things that they are to be screening us for. And yes, our mental health is part of that. But as we get longer in that list, it is of really, we hope, according to national guidelines, that visit takes longer. The national recommendation is anywhere from 30 to a 45-minute visit with the screener, with the physician, with the provider. And then, of course, then you will go to get other kinds of follow-ups, get that blood drawn, or if there is a concern with your bone structure, get that bone scan. So well visits are not to be taken lightly and off the cuff.
And this is a time to be honest, because I know, as a guy, sometimes we think, a little ache and pain, we're not going to bring that up to the doctor, we're not going to ask questions about it, but really that's the time. They've already set aside this time to see you. That's the time that you really need to ask your questions, be honest, let them know what's going on in your life and the types of ailments you might have.
Yes, yeah. It's a curious thing. A Cleveland Clinic study in 2022 of men revealed that 81% of the men in the sample, which was a 1,200 number of men who responded, said that 81% they have good health. 81%. The same sample said 44% get checked every year. So it's a belief maybe that I'm doing fine, which we hope our men are, goodness sake. Women, there is a national standard for women to have exams. Kansas, as of last year, 2023, 72.2% of women who responded to the questionnaire in the state say they get an annual women exam. Now, what does that mean? Does that mean it's a reproductive health exam? Does it mean that we go in and we get our cholesterol and our blood and our diabetes and our eyes checked too? The national standard is a little bit higher, like 73%. So Kansas is not, according to the respondents, that far off. We've improved, actually, for the number of women who say that we get our women checked. And it's interesting to me that men don't typically worry about it or don't communicate it. So you mentioned communication with physicians. I think as adults, it's important for us to own our health, for us to create a team approach with our physician, with our providers. And if we can, not be afraid. There are 5 steps that the National Institutes of Health recommend that we as adults need to use when we think about, I am going to schedule my wellness check. And the first one is schedule that wellness check. That's the first thing.
Do it, right?
Actually do it. So that means schedule. And then number 1, prepare. And what does that mean? Prepare to have time. Prepare for, I am taking this seriously. This isn't just a offhand, I'm going to be 10 minutes late, I'm going to leave 10 minutes early and goodbye, and I'm not going to see you again. No, we need to really think about these are screenings, and there could be maybe a handful or as many as, like I said, 15 if we head to toe, in and out, So number 1, prepare. Number 2 is make sure that you feel comfortable by having your data shared with the physician. We may be embarrassed. We may be not sure that we should say something to our provider, to our doctor about something we're worried about, something we've noticed, a mole. The bowel movement is different. We have vision problems. I'm not hearing as well. Our providers won't judge us. They are trained in understanding our body and how it fits into our mental health and how we communicate. And yeah, maybe your description of what's happening with your body can be embarrassing for us, but they're professionals, so they probably have seen it.
Right?
They probably.
Right. That's right.
Number 3 is ask the questions and speak out. And yeah, Jeff, nationally, some of the surveys of how long a physician spends with the patient, clear back from 2017, reveals an 18-minute period of time. So if that's the average that we have to create a team to communicate our concerns and to listen to what the doctor says, we better be pretty efficient. We better be forthright, and we better ask things in a way that the provider can answer. Number 4 is if you do run out of time, follow up. If you do feel you've been hurriedly through the procedure, you didn't get your questions asked, let alone answered, then you know what? I hate to say the word consumer, but that's really what we're doing. We are purchasing, if we have insurance, hopefully, or if we have some other way to pay for this professional care, we do have the right to follow up.
That's really just advocating, right,
yeah,
for ourselves.
Advocate. And that's number 5. Yes, advocate for self. I think several of us, as we get older, make assumptions that somebody will follow up for us. No, we're in charge of our health care now. We need to advocate for ourselves. If we don't understand the lab results, if we don't understand why this procedure is necessary, if we want to understand more, if we want to be a partner with our care provider, advocacy is our responsibility.
One of the things I think a lot of people have difficulty with is trying to remember when things happened in the past. And family history can be extremely difficult because, gosh, you can't remember what your dad suffered from, what your mom suffered from. So family history is maybe something that we need to spend a little bit more time on because it's going to be on the questionnaire.
Yes, and that's one of the wonderful results of the Affordable Care Act, is that no matter where we happen to live or work or move to, that electronic health record is a way for us to know that our health care history is with us. And when the doctor, when the physician, when the office asks you, go through this check before you get into the waiting room, make sure that everything is current and tell us what's happened since the last time we saw you. And if the record is not accurate, correct it.
In addition to really having the early detection of a possible problem, there's also an opportunity to maybe see something that may be coming on that you can just do some lifestyle adjustments, some improvements, and that may take care of the problem in and of itself.
Yes. Those small tweaks early on are better than having this very, very serious concern. Let me take a moment and talk about why people don't get wellness checks. There's a lot of reasons. One is that, again, we believe we don't have time. The other thing is that we have a large population in Kansas who are not insured. And if you aren't insured, how do you pay for that? So access to either public insurance or private. Medicaid would be a public. Medicare is a public insurance. Those that are working may be insured by their employer. So usually those big insurances have some preventative screening, preventative care. And then the other thing about a state like Kansas is the geographic distance. So Kansas is among many, many, many states who have shortages in healthcare providers and access to care, especially if you're in a frontier or rural area. There aren't enough obstetricians. There aren't enough general practitioners. There aren't enough people that are looking at our mental health. We do have a shortage in all those areas. We have a shortage in dental care, too. And then our pharmacies. When we think about the local pharmacy may be at risk to close because there just aren't enough people purchasing, or they're purchasing online. So when we think about shortages and the length of time it takes for somebody to drive 2 hours to get a wellness check, and they aren't a fan of those anyway, so there's a lot of excuses not even to schedule. So there are many barriers, many dilemmas, but as a community, as a state, we could talk about access to care. We could plan for broadband to do telehealth. Some of these screenings could actually be done through telehealth. There could be other like mobile clinics. So there's some workarounds just to keep us healthy and engaged and working.
If I hear what you're saying correctly, you're saying that we need to stop making excuses and just get to the doctor's office.
Get it done. Just get it done. You're right. Adults are really creative with our excuses and our reasons why not. And we are modeling, Jeff, we're modeling for younger people who I think we all realize they need to be as healthy as they can. They are our workforce. They are our Kansas opportunity to have the state really thrive. So we are modeling that behavior. We're informing our young people what is health, what is wellness, and then what could be a concern, a disease, a condition that does need care. If it's a chronic condition, diabetes, those wellness checks become even more important because, yes, we have people ourselves dealing with chronic conditions, which we don't want to become worse. So when we do schedule, it's for our family, ourselves, our workforce, and for the younger people watching us.
Extension does have a number of publications on health and wellness, a number of programs that they do locally as well. So a lot of help just from your local Extension office.
Yes. There is a series of publications that Extension has done, evidence-based, very well informed on men's health. Some of that hypertension with men, heart health, arthritis. We have a series for women's health, and it's interesting. The series kicks off with the first issue about women are the promoters of health in their households. Yes, there is research that shows women are usually the ones who will nudge and needle the family members to get something checked, and they'll even make the call. So women's health is not only for our personal wellness and well-being, but we're almost setting the standard for the families we're in. So there's a series, it's in Spanish, for women's health.
That's Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University. To learn more, contact your local Extension office or visit nih.gov. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. And this is the K-State Radio Network.